Hi, good afternoon, everyone. Thank you for joining us this afternoon for our special program, Ask the Expert, Setting Up for Success with Dementia Home Care, featuring Laura Radensky, licensed clinical social worker and executive director at COMI, so Concerned Home Managers for Elderly Home Care. Thank you again. I appreciate everyone joining for this presentation. Just a quick reminder, this program is recorded. I ask everyone to please keep their mics muted. We will have a very short Q&A portion at the end with Laura. I, again, ask everyone to please keep themselves muted throughout the presentations. Any questions that you may have, please share with us in the chat. We will again have a short Q&A presentation at the very end of this program. So before we begin our special presentation, I do want to share some very quick information about the Alzheimer's Association. So again, we know that Alzheimer's impacts our families very drastically. We know that close to 7 million Americans live with Alzheimer's or another type of dementia in the United States. We at the association also know that the impact on an individual, both with a diagnosis as well as individuals navigating as a caregiver or a care partner, are incredibly immense. We appreciate you for letting us be part of this journey with you. We hope that after this presentation, you'll still stay connected with us as we have a number of different programs and services that are completely free that we want to make sure that our community is aware of. So very, very briefly, I want to share that we have a 24/7 helpline that's available for you across, it's available for you again, 24/7, the number is 800-272-3900. I want to mention that while we are here in the New York City chapter, this is a helpline that is available for you across the country. We have dementia care experts that are trained in offering you support, navigating the day-to-day, connecting you with resources in the community. Our representatives have the capacity and ability to serve you in over 200 different languages. Again, if you are living outside of New York City or New York State, please know that the Alzheimer's Association, we're here to provide that support to you across the country. We have a number of educational programs available in person as well as virtually. Our Ask the Expert series is one that we have a wonderful library available on our YouTube page. So please rest assured that that information will be shared with you after this presentation. And one service that I want to really highlight today are care consultations. So our care consultations are a free service that we offer either one-on-one or with the family to help you navigate the day-to-day, to help with the planning, whether it is the need to figure out how to facilitate a conversation with an individual that you suspect might have Alzheimer's in your family, whether it's searching for a diagnostic center, or if you're navigating changes in a person's ability to navigate their day-to-day life. We are here to offer that support. Another thing that I do want to mention is that perhaps you're in a situation where you don't know where to begin your journey as a caregiver or as a person with an Alzheimer's diagnosis. Please know that we're here to offer that support to you through every phase of your journey. This is a completely free service that we want to highlight. So if you want to get connected with us for a care consultation, know that you can call our helpline at 272-3900 or send us an email at nyccares@alz.org. And please know that I will share this information with everyone after the presentation. So without further ado, I am very honored to welcome everyone to our Ask the Expert, Setting Up for Success with Dementia Home Care, featuring Laura Radensky, Executive Director at Comey. So I'm going to go ahead and stop my screen sharing and pass it on over to our guest speaker. Laura, thank you again for joining us today.
Okay, thank you. Okay, let me just share my screen and whoops, okay, and go back for a second. Okay, very good. So again, yes, Laura Radensky, and I am director of a licensed home care agency in New York City. So I'm going to specify, I understand people are in different locations, so I'll specify when some of my information is specific to New York State, but I'm sure there are similar situations or resources in the places that you are. I have worked in, I've been director of a private pay home care agency for the past 9 years, but I worked over 20 years with both Medicaid and Medicare home care programs. What we're going to do today is talk a little bit more about introducing the idea of having help, how to choose an agency or how to hire privately, what to ask when you're researching about agencies and trying to choose the best agency and or best caregiver. So I definitely have another recording which you can find on the website regarding more of the kind of basics of Medicaid versus Medicare, et cetera. But certainly, and you can watch that, but certainly I can handle, some questions if you have them at the end about those issues. So how do you know when you need home care? That's very much a balance, kind of balancing the dynamics of looking at the situation and what's happening. I think very helpful to engage family, friends, sometimes third-party professionals, right? Can be of great assistance figuring out the benefits and disadvantages, but also just kind of monitoring what's going on with the current situation and how much you're able to handle it. But some signs certainly occur when you realize that you're having more worry, right? When you're leaving someone alone for periods of time. Multiple falls is another sign. We just got a call yesterday from someone who had reached out about a year ago. I think we even had done an intake visit, and then they said, oh, we're not quite ready, but 2 or 3 falls recently has led them to call us again. Arguments or frustration regarding the safety. And then, of course, there's those, instances that are real red flags, leaving a pot on the stove, a wandering episode, or the realization that some medication dosages are being missed are important. But for a lot of people also, there's just changes in mobility, right, that can lead to realizing that there truly is a further need for help with tasks. So, and it's sometimes not so easy for us as the ones arranging for care to get into that mind frame, right? I've heard that, people always talk about, oh, the caregivers, and most of us don't think of ourselves as having that label, right? We think of ourselves as the son or daughter or the wife or husband or friend. And so important to figure out the expectations of how much you're taking on for yourself, how much there's safety issues going on, as well as what are the expectations of others, right? They may some others may think, oh, it's really, home care is really expensive. Of course you can like manage everything, but they may not really know on the ground what's going on day to day, and how much even having some amount of respite is really going to be helpful and crucial. So in terms of introducing the idea of care, sometimes it can be just kind of on a gradual basis, mentioning situations or times like, oh, that medical appointment would have gone a lot smoother if we maybe had another pair of hands, right? Helping with getting equipment in the car or cab. Um, Examples of friends or neighbors who are benefiting from an aid, but also emphasizing that it's not just, the person needing care who may need help. It may be you yourself, right? Who is, that the situation overall really is calling for more assistance than you've had in the past. And the cognitive issues can make this an even more challenging conversation to have, right? It's uncomfortable for any of us, right, to admit that we need help or that there is a dependency. But I think even more so for someone who's, especially when there is realization of, oh, my memory's not what it was, or I am having periods of confusion. So the idea of, oh, now an unknown person is going to be introduced into my life, whereas what they're really depending on right now is familiarity, can make it even more challenging. And in addition, there just may not be an appropriate assessment of safety because of that impaired memory and judgment. So important again to, and much as it's kind of hard sometimes for all of us when we're dealing with very emotional situations, or as I said, frustration and stress, but listening and acknowledging, especially home care really, it's being provided in the intimacy of the home. Right. So there's a lot of privacy issues, somebody helping not only with one's day to day, but even in the bathroom and, with hygiene and other areas, as well as, the need for control. But important to listen to the concerns and to be sensitive that it's, yeah, for most of us, it's a hard, not an easy transition to make, to have somebody encroaching on privacy or control. So some of the ways that one can go about to manage, dealing with people who are saying, oh, not me, I'm not having home care, is consider doing trial periods. Our agency, for example, will provide services for 2 weeks or more at a time. And we definitely have had people who've said, okay, we're doing this for a month and going to see how it goes. The one thing, and I'll talk a little bit more about it later, is, be aware of termination clauses if you're using an agency in that way. But for most agencies, they will do temporary services. Good also, maybe if you're finding you're having the same conversation over and over again, to enlist the help of others, sometimes a trusted physician or a friend who's very trusted can help to be the one to have the conversation. And also just the assurance that the first person hired doesn't have to be the last, right? Even, it can be done on a trial basis. As a matter of fact, we often refer to the fact that, to begin with, it's very important to realize that there may need to be a period of time to stabilize the situation. So one also, and I'll give an example. We had a case where the way that they started is actually they arranged services with a companion agency. So they were provided a person who couldn't do hands-on care, but actually somebody who was an artist and involved with art, and and that person was coming on a regular basis. So it providing more of socialization, but it was kind of a first step. When they called us, they sort of said, oh, you can come and do the intake, but don't say the word home health aide. Like it's a friend or a companion, which it is a little uncomfortable, but we were kind of like, okay, we'll do it this way. They hired us for services once a week for quite a while, and got the woman who was having the service more used to it. And then only about, also at the time waited through the exclusionary period for the long-term care insurance. And then once that kind of kicked in, they just started with us about 2 months ago for 4 days a week. And it's been working really well because she had a chance to get to know the person. It kind of was, more gradual and allowed for, that gradual piece of care. With some other people we've had, there's much more of a focus also on housekeeping, right? Because the home health aides can do laundry, meal prep, shopping. So that, focusing on that rather than, oh, this is the person who's gonna, be contact guard every time you get up. That, we were focusing more on what they would normally, even in the past before illness, have been more accepting of. So a lot of people ask, how do I decide between private care versus agency care? So there's a few things that the agency will definitely take care of, including payroll taxes and withholdings, any kind of, unemployment contribution. Agencies also will cover work-related injuries through, workers' comp. And we'll take care of all of those pieces of background checks, reference checks, doing verification of credentials. In New York State, there is, and I assume in many states, there's something called the Homecare Registry. So with any person who is applying to be a home health aide with our agency, we can go in and see what other agencies are they currently working for, where have they worked for in the past. And then we also will be notified by New York State if, God forbid, there was any criminal, a conviction or something else happened, automatically we are notified of that right away. So there is that that extra, coverage. And in addition, and when we say licensed agency, it really is that it's the Department of Health supervising. All of the staff then will be certified. And I'll talk in a second about what that means. The aides are then supervised by nurses so that they can provide the personal care, like grooming and bathing, and will have, further orientation and training given by a nurse. In addition, when you have an agency, you do have that backup relief coverage, right? Someone calls in the morning out sick, there's other staff, to fill in. And in addition, they're required to have nursing staff available 24/7 in case there's any, medical emergencies. One other thing that people don't often think about, but we, as agencies and as we deal, unfortunately, with more and more, situations of disaster preparedness, all agencies do need to be equipped to handle if there is some kind of emergency and have, plans for what they would do with different, in case of different scenarios. So when I say that an aide is certified, what that means is that they have between 2 and 3 weeks of full day trainings by a nurse. In addition, and again, I am a little bit New York specific, but I think it holds in other places. There is ongoing training. New York State requires 12 hours mandatory to maintain certification. And in addition, most agencies provide further training to manage dementia behaviors. I know we every year have our aides do extra training on handling dementia since it can be so difficult. We also, as an example, got a grant and we are working with the Parkinson's Foundation to make sure our aides have more knowledge about, the fact that medicines for Parkinson's have to be given on time, or what to do if somebody, freezes up in terms of their mobility. So those extra trainings can be really helpful. So a lot of people ask me, can my private aide become a certified home health aide? That is possible. Certification is available at both for-profit and nonprofit agencies. One thing good to know is that even if someone comes to you and says, oh, I was certified, but it was like 6 years ago, they will have to do training again in order to get their certificate up to speed, because if they haven't worked for 2 or more years. Another thing to consider, and we've had this come up a couple of times, that we've had clients come to us saying, oh, my insurance can kick in. I want to, go with an agency. Can you hire my private aid? And most agencies are very happy to hire, but then sometimes it comes up that, oh, they actually aren't able to work in the US because their paperwork hasn't been processed for immigration, or language skills are not up to speed. Again, costs for training for, if aid is paying, is between $500 and $600. But there are some agencies that do the training themselves, but then will have the expectation that that person will work as a home health aide for their agency. So talking now, kind of going over to, that's the kind of the agency versus doing private pay. So, and I always get the question as well of, why is it so expensive? Home care workers in New York State, it may even be one of the only categories, but there is a different minimum wage for home care workers. It is in New York City, and it's different even around the state, but right now it is $19.10 per hour. And whereas the minimum wage otherwise in New York State is $16. So again, it's that amount plus the payroll taxes plus, and then with agencies you have, right, those other liability insurance and other pieces that impact in terms of the costs. So how does one go about paying? So for those fortunate through their work, or they voluntarily got long-term care insurance, one thing I will kind of preface by saying is that all of those policies are different. So it's good to, to review one's own policy. But in all instances, one does need to put in a claim and obtain approval. Approval is usually based on activities of daily living, but they usually do take into consideration dementia, or other cognitive impairment, even if there's, less actual physical activities that are problematic. Most include an exclusionary period, but it varies greatly. It could be, often I see 60 days, I hear of 30, 90 days, I hear of different ways of counting the days. So I get questions of, can I have care just for 2 hours a day? Because then my insurance company will count that as a whole day. So that's one piece. I also hear very generous policies where they say, oh, each day counts as 1 week. And then, so the exclusionary period can go by very quickly, but important to look carefully at the policy itself. So if you are using an agency, and not all of them require, that's another reason to look at the policy. They may say, oh, you could hire yourself, but you would need then to be the one doing the supervision of the aid. When you do hire an agency and have long-term care insurance, most agencies are willing to accept direct assignment of the benefit, meaning you don't have to put anything out, or only put out the portion that the insurance doesn't cover out of pocket. But even if you are the one getting the direct reimbursement, the agency should still be able to provide medical documentation as requested by the insurance company, and regularly fax or upload to the insurance portal invoices, as well as duty sheets that will confirm that the care was provided. So this next slide talks a little bit about, this is a New York State program that's with some state funding, providing hours of home care on a subsidized basis. It is for those with more limited incomes, and there are waiting lists. But that is another way if one is above Medicaid level, but not by that much. And I know different, yeah, states have similar types of funding. Usually this is for shorter hours. So like 3 days, 4 hours, something, or 2 days, something along those lines. Other options in terms of hiring care, there are agencies that provide companion care. They have the benefit of doing the interviewing and reference checks and background checks. Some of them may provide, some ongoing oversight. Others may say, okay, this is the main thing we've done. And then there's also registries. Those are run by individual care managers that also provide screening assistance, and sometimes also will provide, ongoing management of the home care personnel, but it may be limited. So difference between a companion and a home health aide, and I think it's important to keep this in mind. When you hear somebody cannot provide personal care, it really means that hands-on care of dressing, toileting, bathing, grooming. It's a little hard. I myself sometimes am confused when I, check websites. I'll be kind of looking around in different places because sometimes they'll have a list of tasks that it's not so easy for me to tell if they are licensed or not. So sometimes, yeah, it may be important, to ask that. And one telltale sign will be, do they have nursing staff who are supervising the aides or not? So, yeah, so some of the things to consider is who is supervising the aide. So if you're privately hiring, who in your constellation, would it just be you? Is there even some backup if you're not available, as well as backup for the aide? And sometimes with private aides, they will have, right, there'll be, I know in some of the housing developments where we provide services, sometimes there's a group of private aides who kind of do provide backup for each other or friends. But good also if you're privately hiring to put all those issues on the table and not get to the summer and then realize, oh, they thought I was paying for 3 weeks paid vacation. Like just like with any kind of situation, you want to make sure that those things are understood. Sometimes you can get additional training. We make use sometimes ourselves also when we're training of YouTube videos in terms of teaching about transfers and things, but some of the agencies also, Parkinson's Foundation, Alzheimer's Association, and others might have some courses or training for private caregiver, the private caregivers also can take. But these are just some of the questions you might want to consider when you're trying to decide whether to have an agency or the or privately pay. So I'm going to go on from here to talk a little bit more about finding an agency. Many people start with lists from trusted care providers. Almost, yeah, all hospitals and rehab facilities will have lists to provide, as well as social workers and word of mouth. I also particularly, if Alzheimer's Association, I would definitely make use of those care consultations. But they also have lists as well as these other agencies. And sometimes, right, if you're dealing with a specific illness, it's good to make that connection and get those recommendations. It's also possible to hire a geriatric care manager. That would be somebody, usually it's a social worker or a nurse, but again, also to make sure of what the credentials are of that person, who can help with making home visits and help to oversee the home care. A lot of times people find this very helpful if they're far away and having to hire care. It can, be somebody who then can be the feet on the ground, right? And accessible when you're not able to be. But they also usually have a lot of resources and sometimes may just be helpful at the very beginning, just to kind of get that structure set up and get some further assistance. So finding a good one, once you have those lists, is not always so easy. I know even in downstate New York, there's over 400 different agencies. Many are franchises and smaller agencies. So some of the things to take to kind of keep in mind as you're looking is what are the needs going to be? There's usually a difference between paying hourly versus someone who's round the clock live-in. What are with an agency? Do they have care minimums per day? For example, we have a minimum of 6 hours a day. The lowest I hear of these days is 4 hours at a time, but I have even heard of 8 hours minimum. Costs, and then is it going to be mutual care or not? Meaning, will one aide provide services to two people? And if that's so, then there should be, a discount in terms of the cost. So, for example, we charge basically it's like time and a half, 1.5 times for mutual care. So questions to consider when you're choosing an agency, of course, who's supervising the aide at the agency, and do they offer other services or support? So, for example, we provide social work services. I've heard of agencies providing specialists regarding, managing dementia behaviors. I know I'm in the midst right now of looking into somebody who can do home safety consultations to kind of come in and look around and make sure that that equipment is appropriate. You want to ask, of course, what happens when urgent issues arise? What's the policy and procedure for calling out sick or taking vacation? As well as I mentioned already, regarding the specialized trainings. So in terms of intake, usually, right, will be often if it's a licensed agency, it will be a nurse, but it could be a social worker or other agency staff. Almost, yeah, I think all of them have a service agreement because they'll want to be laying out for both you as well as for them what their responsibilities and expectations are. There's also, with agencies, you can expect to get a lot of HIPAA forms. Many are doing this electronically with Adobe Sign or other types of signing. You also want to look when you're reviewing the service agreement, as I mentioned before, important to check the termination clause because you don't want to be surprised if, things don't work out and then all of a sudden you realize, oh, it's, I have to give 2 weeks notice and I didn't know. Security deposits are required by some. We, for example, require 1 week. I've heard of 2 weeks, but they may not do that. They should allow you to be able to interview the aide and let you know what the process is in terms of matching up aides with clients. And crucial, of course, is knowing and making sure that you're easily able to get in contact with the person in charge of scheduling changes or troubleshooting if there's any problems. So yeah, and this kind of goes into, right, about the termination clause, making sure of how much you're expected to pay and when, and also just making sure too that, that the insurance company is going to be receiving any documentation that they're supposed to. So, and again, I give the caveat that's different in different states, but Home health aides are supposed to be able to give medication reminders, but not to actually administer the medication. This means in New York State that an aide could open medication bottles or a Mediset, put the medication into the person's hand, as long as the person can physically bring the medication to their own mouth, or if it's an eyedropper, the person, the aide can help to put the eyedropper over their eye, as long as the person can help with squeezing the eye drops. That's considered, right, that last step of administration is what's considered medication administration. So in many instances, even with somebody with cognitive impairment, the aides can do the reminders. Sometimes this comes up though, especially end of life, if there's injections, morphine, something else like that. A licensed agency in New York State cannot do it. All states have all different ways. New York State has been trying for quite a few years to implement, well, they implemented a bill, an advanced home health aid bill, but the training never got kind of off the ground. So as it stands now, it's just good for you to be aware of what kind of limitations there may be in terms of what the aides can and can't do. So if someone is coming home from the hospital or and in need of 24/7 care, there's usually a couple of different options. One is to have 2 different aides for 12 hours per shift, or to have one aide working a full 24 hours, which is referred to as live-in services. So, so live-in means, right, 8 a.m. Monday to 8 a.m. Tuesday, basically. The Department of Labor in New York has a rule that that the aide needs to have 3 work-free hours of mealtime, and as well as 8 hours of sleep, 5 of which are supposed to be continuous. And the rule of thumb that I usually share with people is, if they're waking up once or twice a night, that usually is fine. We don't generally have aides saying, oh, it was, I was at 4.5 hours. But if they are really waking at 12 and then 2 and then 5, that's where it's going to really be a problem. And important to know, and there's been quite a few court cases and lawsuits regarding this, but because the Medicaid system would also be on the hook if this didn't exist, we continue to have this definition of live-in service. And but if an aide, and I just had this recently, actually, somebody who has had live-in with us now for 3 or 4 years, she had a fall and had some pain during the night and was up all night. So I just actually got a supplementary timesheet from her saying that she needs to be paid for 8 hours of care that night. That will, to the client will be billed also for those 8 hours. But fortunately, it was just the one night, and then it was addressed. So just help, important for you to make sure the agency's informing you of those kinds of payments, and also to be aware that there are, because there's been such controversy, some aides I know like to provide live-in service. One of the arguments in these court cases is that it's not fair, that the person still has to be on the premises, but they're not being paid for all 24 hours. They're being paid for 13 of the hours. So there's definitely arguments on both sides, but just as an example, where he's worth $38 an hour, which comes out to over $900 a day for live-in service, it's $495 per day. All of which is still a tremendous amount of money, but it's a big difference between the two. So just moving along, and again, I will leave time for questions. Interviewing aides, very important to make sure that everyone is aware of each other's time schedules. So I just recently had a situation where the clients loved our aide, but the daughter is a school teacher. And even, much as the aide tried to get to work on time with the subway system, she didn't quite ever have enough of a cushion. And they recently, yeah, made a change because that daughter needed to be out at a certain time because she had to teach. So when you're doing the interview, helpful to ask, just general questions of why did they get into this type of work, and what sparked their interest. Why, why do they like working with older adults, as well as just in general, what are hobbies and interests? In addition to, if they do have any special training or certification in certain areas. But remember, it's a job interview. So in terms of personal questions, asking how many children they have and how old they are, or, um, or about pregnancy those are problematic questions because it is an interview for a job. Um, and important too when choosing an aide, personality matching is crucial. I know I have some of our staff here who are very chatty, who I think if I had a home health aide, I would not do well with them, but I get rave reviews of them from some of the clients where that's the preference. Whereas in another instance, it may be that somebody quiet, calm, who's going to, be in the other room a lot, works better. So important to take those into consideration, as well as, and I talked already about time frame needs, but length of time they've worked. I always, ask new aides when they come to us, what their experience is. I'm sometimes surprised, even ones who've worked for a number of years who tell me, no, I don't have that much experience working with someone with dementia, or that they never had to deal with transfers. So important, to know those types of things depending upon what your situation is. So with agencies, we always will have a plan of care available that the nurse does where tasks are checked off. But if you're hiring privately, I think it's a really helpful thing to have on the refrigerator or somewhere nearby, kind of outlines of what's good, especially for when the person themselves has cognitive issues and may not be able to direct. We always love to do cross training. So if you already have someone who's been working for you who could show the ropes, so to speak, to the new person, that's helpful. And also keeping in mind, and we see all the time misunderstandings or miscommunications. We really, if we have more than one person working on a case and there's a handoff, really very helpful for them to kind of do a walkthrough and take a few minutes at least to just make sure of, what's going on in the different rooms, what's happened most recently in terms of the care, and to be able to share whatever knowledge they have. It can definitely help in terms of also any future arguments or conflicts regarding what's being done. Some other things to take into consideration is, pet care. So at this point now, we do let people know we can, provide dog walking or changing litter, but we do charge an extra amount per day. That's not something that's on the plan of care, right? To do that, but also good to be aware that people coming from different cultural backgrounds, other countries, may look up at animals in very different ways from the way you do. So for example, I have a lot of staff now who come from countries where you would not normally have animals in the home. So what I hear a lot is, oh, I'm allergic. You know, when I first came here, I was like, I'll pass out Zyrtec to everyone and we'll be fine. But truly, sometimes it's, you know, and they would say, I'm scared. You know, I've never had to deal with dogs daily. So important to keep that in mind. Um, Also, to be upfront about dress preferences. If someone, and again, this is in New York State, uh, if one of our clients prefers that someone wear scrubs, we're actually responsible for buying the scrubs and making sure they're laundered. But that's something else also, you know, that you could share with someone. And then housekeeping, when there's more than one person in the household, is an area of major concern sometimes, depending. So our rule of thumb is if an aide is already doing meal preparation for one, they could do meal preparation for two or three, right? It's not that hard to expand in that area. But if we are, you know, don't have a plan of care for other household members, then the expectation would be that like housekeeping would be done in the rooms that the client uses. And in addition, like laundry would be done for that one person. I think in many instances, and you know, that this can be a little bit flexible. And I think a lot of times when an agency's involved, like I'm pretty sure a lot of my staff just don't even kind of bring it up. But it's important to know what what the boundaries are actually, and where there's wiggle room versus not. Okay. So other things, and again, this is with private care or with agency care. It's very important that the staff understand whether the person can be left alone or not. Including, you know, is it okay for the 15 minutes to go, you know, run quickly to the store or not? Um, and in terms of meals, so I know for us, our staff are expected to provide their own food for themselves. And I think that is in general the way it works with agencies, unless it's a live-in case where it would be difficult, right? If a person is living with the other person for 4 or 5 days at a time, then the expectation is that the client and family are providing meals to them. Phone usage is another area of concern. Sometimes we, of course, as an agency, we discourage the aides from using their phones. But you may feel downtime. It's okay for a little bit if they don't want to watch the same news or whatever, that's not a problem. But in general, they're working, right? They're getting paid hourly. They should be available, and not be using their phone constantly. So another thing that we encounter, I get a lot of questions about, okay, if a person's working overnight, you know, those 12 hours, the expectation is really that the aide is awake and available at all times. So important as well to make sure that, you know, if you want to ensure wakefulness, that there's a room where the light can be on, a place, you know, where they can sit. Sometimes, you know, people set up with monitors or other, you know, methods if the person isn't, you know, in the bedroom with the other person, but there should be a way that they are going to be available at all times. So just in general, and you know, good to talk to others. That word of mouth is important. Expect to have to make changes sometimes and need to have flexibility, but good. I see, yeah, for all of you attending here, you're doing your research, right? Trying to get more information, and know as much as you can, because it is, nothing else, a very complicated system, especially with the different payer sources, right, for Medicare, Medicaid, and the private pay, and expensive. So really important for you to gather this information, try to interview as much as you're able to, ensure that you're reviewing the paperwork, and ensure that you get the best, most appropriate care. This is my contact information. We also, when people call us, we always will, if we're not able to provide the services, we will, give resources. But I think really also the Alzheimer's Association care consultation is an excellent way of going about this. So I am going to stop sharing now. And yeah, and I can take any questions.
Thank you so much, Laura, for an excellent, and very informative presentation. We did get a couple of questions in the chat. One question was regarding information about home care agencies, whether that is provided through the Office of Aging. So I did share that link in the chat. If I do have anyone who is listening in on our presentation using the phone audio option, please know that this information will be sent via email. If you registered without an email, I will follow up with you as well so that you have access to that. We had a question from Olivia. The question reads, Laura, can you speak to the use of video cameras in the home?
Yeah. So, yeah. And again, I apologize if it's different in other states, but in New York State, it is allowed to have video cameras and not to share that with the staff. We generally, our policy is that we definitely, if we know, as an agency that there's cameras, we definitely share that with the home health aides. Um, I think that, I know a lot of people who feel a lot more peace of mind being able to watch the videos. And yeah, and we basically just let the aides know that, they should just be aware that is, another way that people kind of check and have and feel more comfortable in terms of having the care.
Thank you, Laura. Another question that was submitted by Marlene. Does an MD need to recommend home care if one wants to go through insurance for payment?
Yeah, so for licensed agencies, as well as any care provided through Medicare and Medicaid, there are physician's orders that are drafted by the nurse, the nursing staff, and then signed by the doctor or a nurse practitioner or physician's assistant. So yes, in most instances, and definitely Medicare and Medicaid, but Medicare especially does require that there be MD orders.
Thank you, Laura. So Carol shared that this was very helpful and shared her appreciation. Edwina shared a question asking, are there specific questions that you can ask a potential healthcare worker or healthcare workers?
Mm-hmm. Yeah, and I think, yeah, I mean, I definitely on one of the slides, you know, and you will get the slide deck kind of mentioned. I'm surprised sometimes when we ask, oh, why'd you get into working with older adults? I mean, there's sometimes some beautiful stories of the reasons that they got into it or that they enjoy it. But hobbies and interests, I think, also can be very telling. And it can be telling as well if the person kind of brushes off the question, right? And is like, oh, they don't want to reveal anything about themselves. But that I think those types of questions are a good way to go. And then again, as I mentioned, experience with dementia, experience with transfers. I have been very surprised sometimes when people said, "Oh yeah, I've been working 8 years. I've never had to do any transfers." I always worked with somebody who had, independence and mobility wise.
Thank you, Laura. Laura, one question was asking if your agency is or service is Westchester, and if you don't service Westchester, if there are referrals that you
Mhm.
can provide.
Yeah, so we do not service Westchester, New York. State gives the license in to very specifically in terms of counties. We service the 5 boroughs, but definitely you can give me a call in terms of, and I can put in the chat my information. I mean, again, I think that Alzheimer's Foundation also can provide that type of information. But I also will put in my email address as well. But we're always happy to give, and we always will give like 3 recommendations. But yeah, places in Westchester for sure.
Thank you. And to your point, Laura, yes, we here at the association, you can give us a call if you're watching this as a recording on our YouTube page. Please feel free to give us a call at 800-272-3900. While we don't particularly endorse or recommend one agency, we always do provide anyone who calls for this service, particularly a list of different agencies in their area, neighborhood, county that they can reach out to. So thank you again, Laura, for that. The next question, Laura, was from Denise. Can you ask that the aide be able to drive them to appointments?
Yeah, so it really depends on the agency. We're unusual in being in New York City. We don't, our aides don't drive. But in most areas, they need to. It's a question that you need to ask the agency to make sure. But most of them should have liability insurance that helps to cover that. And they may charge more for an aide who drives.
Thank you. And the last question that we're taking today, and I do apologize that we have such great questions in the chat. But Laura, the question reads, does the agency provide a W-2 or a 1099 at the end of each year? How does this work with private care?
Yeah, we provide W-2s to our aides. They are considered our staff. And so, yeah, that's what we do.
Okay. Wonderful. And there are a couple of questions that were left in the chat. I look
Yeah,
at
I can say, yeah, just transfer means like to move somebody from a wheelchair to a bed or vice versa. Yeah, transferring them. I apologize for talking in jargon. Um, yeah, the policies about home care workers receiving gifts. It's yes, usually agencies don't allow it. Like we have they can only give $25 and that's it. As a tip, most agencies will have their own policies. And the last thing I see is the difference between the 24 versus 13 hours. So basically, that's just the Department of Labor in New York State says that for live-in service, you're paying for only 13 hours, and the aide is expected to only work 13 hours because they're either sleeping or have personal time otherwise. So thank you, everyone.
Thank you so much, Laura, for your time. I really appreciate it. Thank you, everyone, for your participation. Please know that this recording, as well as the slide deck that Laura so graciously put together for this presentation, will be shared via email. The video will be up on our YouTube page for reference for anyone who is interested in receiving or reviewing the information that was shared. Before I close the Zoom room, just 2 quick items. Again, Laura, thank you so much for your time today, for the incredible information. We are truly appreciative of your commitment to providing information and support to our community. And lastly, I do want to invite attendees to the next Ask the Expert. So I'm going to go ahead and share my screen so if folks can see my screen. All right, folks able to see my screen here? Okay, perfect. So our next Ask the Expert is Navigating Caregiving with Joy and Purpose, featuring Clay Horn III, Faith Winfield, and David Allen, our experts. So just a summation of the program. So caregiving for someone with dementia is an act of love, but it can also be deeply challenging. As part of our Black History Month Ask the Expert series, this hybrid program will delve into the transformative power of self-care, self-love, and pursuing your passion or calling. Learn how creativity and personal fulfillment can serve as tools for resilience, helping caregivers navigate their roles with grace and balance. This session will be held on Saturday, February 22nd. Again, that's a Saturday, February 22nd in Brooklyn, New York from 11 a.m. to 12 p.m. We will have a Zoom option available for folks who are unable to attend in person. So again, to register, I will be sending the information out via email. And as my coworker shared, you can call us at 800-272-3900 to register for this program. We look forward to seeing you there. And thank you again, everyone, for joining our program today. Have a wonderful day, everyone.